Sickle cell disease, also simply called sickle cell, is a group of hemoglobin-related blood disorders typically inherited. The most common type is known as sickle cell anemia. It affects the shape of red blood cells, which carry oxygen to all parts of the body.
Over 8 million people worldwide live with the disease, over 100,000 in the U.S. We spoke with Dr. Brandon Bentley from AU Health and WellStar MCG about the causes, symptoms, and possible treatments.
Dr. Bentley, appreciate you joining us again here. This is something that affects a lot of people, sickle cell disease. A lot of people hear it, but they may not know exactly what sickle cell disease is.
Yeah, so sickle cell disease is an abnormality in the proteins that carry oxygen in our blood. So hemoglobin, pretty commonly thrown around word, but that is a protein that's carrying oxygen, and that abnormality is a genetic trait. There's thought to be some benefits, however, not completely well known. And this is a sickling of the protein. And unfortunately, that can lead to blocking of the vessels because it's no longer that nice disc shape that's moving through the vessels smoothly. The sickling can get caught and it gets clumped together, and then that blockage creates problems down the line.
And how can you know if you have sickle cell disease?
So the most common way for people to know about sickle cell disease is from prenatal or neonatal testing. So either before birth or right after birth and discovering at that time. However, if you're an adult and you don't know, you can ask your doctor for a blood test. You can check to find out if this is something that you might be a carrier for sickle cell trait, or if you may have it and you just didn't know about it. So that's the most common way. Certainly there are other ways in case there's a major side effect or you end up with a sickle cell crisis and you end up in a hospital and you find out that way. But hopefully that's not the way you're discovering that you are suffering from this.
What kind of symptoms should you look for sickle cell?
So when we're younger, because usually in the first number of months, this is something that we're not necessarily seeing the side effects from, but it's fussiness or perhaps some jaundice or yellowing of the skin or eyes. There's also pain that can lead because of that occlusion in the vessels. So that's something that we'll see a little bit more down the line from the sickle cell. Unfortunately, there are some further complications that we hope to avoid with treatment.
And what are those complications?
So you can end up with things like stroke, blindness, something that's more common if it's not completely treated or taken care of, or acute chest syndrome or a lot of pain. Our big ones are just pain and even spleen loss. So there's just a lot of downstream effects. Anywhere that blood can flow, blood can get caught, right. And that's why we run into these problems down the line.
So here's the big question. Is there a cure?
So the cure at this time, there's a number of treatments to help with the side effects of the disease, some of the pain that can be associated with it. The known cure would be a bone marrow transplant. That's not for everyone. So you have to talk with your doctor about if that's for you. There are a number of approved treatments that have been recently approved in 2023 that they're looking at gene therapies, but they're not widespread or commonly used at this time. But it's something that if you're thinking about it, if you're suffering from sickle cell disease, you should make sure to talk with your doctor about different treatment options.
All right, definitely check that out. Check with your doctor on this if you have any of those symptoms, sickle cell disease. Dr. Brandon Bentley, we appreciate it. Thanks for the time.
Good to be here.
Thank you.